Well, we're in good position to start reopening our economy, but there are four preconditions that are required to be successful at that. And what our goal is now to go from mitigation to reducing the impact of the epidemic to actually containing it, like we did successfully with things like SARS and MERS, and really shut the epidemic down. There'll be outbreaks and there'll be flares, but it'll allow us to return to a much more normal state. Those four preconditions are basically that we can really access our data, that we have excellent data on testing density, case density per neighborhood, and who's getting sick, syndromic surveillance networks. Our great College of Public Health has implemented those, and we've been working with Tampa General and their GE Control Center to really map down to the level of the street where the cases are, who's at risk, and who's been tested. The second is testing and tracing. I know everybody's sick of me saying this. We have to test a lot more folks, at least 150 people per day, per 100,000 population, again, per day. So to do that in Hillsborough County, we need to test 2,250 patients a day. We're testing between 500 and 1,000. So we need to test a lot more folks. And we've been telling everybody not to be tested unless they have symptoms, and because we were trying to preserve our PPE. Well, now we have plenty of that. We need them to come in and be tested. If you want to be tested, we have many, many different sites now to be tested. Come in and be tested. We are welcoming everyone to do that. And that will give us critical data that we can use to move to that containment process. Tracing. Everyone that's positive, we need to quarantine. We need to quarantine their exposures. We need folks to do that work. We have 60 right now. We need about 300, and we're ramping that up. And then finally, we can't overwhelm the capacity of our system. Well, clearly we're not. We're all desperately in need of filling our hospitals. So we're in great shapes there. And then serology, antibody testing. We're working hard. We're going to start that test today here at Tampa General. We're going to be testing all the USF and other physicians. So we think we're very close to meeting those four preconditions in Florida. We know we're there here in Hillsborough County, and that will allow us to really be able to contain this epidemic. There's still things that need to be addressed. We need to make sure the supply of reagents is adequate. We can't get too confident. We need to keep supplying ourselves with that personal protective equipment. And we have to be sure that we can get funding for all these tests so that that's going to be a critical part of our strategy. But we're in really good shape in Hillsborough County. We're in great shape in the state of Florida compared to many other areas of the United States. And we've got a very clear, coherent strategy for being able to begin to reopening the economy without increasing the potential fatalities from this awful epidemic.